Robert Merritt. I'm a thoracic surgeon at the Ohio State University Wexner Medical Center and the James Comprehensive Cancer Center. I'm also the director of the Division of Thoracic Surgery. And I'm presenting my abstract here at the World Lung Cancer Conference 2024 for the International Association for the Study of Lung Cancer. And the rationale for the study really centers around, how can we predict which patients will have a major pathologic response after receiving neoadjuvant immunotherapy prior to surgery. It's very difficult to predict the degree of response to neoadjuvant immunotherapy. And then one thought that I had was maybe we can look at the decrease in the SUVmax of a PET scan that was performed before and after immunotherapy. Fortunately, in the LCMC3 phase 2 study looking at the efficacy and safety of neoadjuvant Atezolizumab for resectable non-small cell lung cancer, I was able to do an ad hoc analysis of this phase 2 study. And we did have patients who had pre-treatment and post-treatment PET CT scans, and all of these patients had received neoadjuvant Atezolizumab, which is an anti-PD-L1 antibody, and we also had major pathologic response recorded for each of these patients. What we found from our ad hoc analysis of the patients who were entered into the LCMC3 phase 2 study, the patients who had a decrease in the SUVmax value for their PET scan after Atezolizumab treatment, it correlated with a increased rate of major pathologic response. So of all the patients who had a decrease in the SUVmax of their primary tumor, 23% of those patients had a major pathologic response, compared to the patients who had no decrease in their SUVmax value after Atezolizumab therapy. Only 2% of those patients had a major pathologic response. So based on these findings, we were able to determine that a decrease in SUVmax in a post-treatment PET CT scan may be predictive of a major pathologic response and may be a non-invasive way of determining whether or not patients had a response to preoperative immunotherapy. There are several other neoadjuvant studies and perioperative studies with immunotherapy for patients with resectable non-small cell lung cancer. So it would be interesting to also see if these studies, if we analyze the patients in these studies, if there's a correlation between decrease in SUVmax and major pathologic response in those studies as well. And I think that would give us more information as to whether we can use this correlate for response to immunotherapy. One other important thing I think would be interesting also to look at is if PD-L1 expression correlates with a decrease in SUVmax, because we know that it does have some implications in terms of major pathologic response or complete pathologic response to immunotherapy. I'm looking for studies for neoadjuvant treatments, particularly with immunotherapy and also with molecular therapies. I think it's an exciting time for lung cancer as we find new molecular therapies and improvements in immunotherapy, which could enhance surgical resection. I think it's an exciting time in lung cancer with immunotherapy, particularly for neoadjuvant treatment or perioperative treatment for patients with resectable non-small cell lung cancer. And I think perhaps using the SUVmax decrease may provide a clinical correlate that we can use to determine whether or not patients need additional immunotherapy after surgery, or in some cases, if they even need surgery at all, if they have a very significant decrease in their SUVmax.